Alrighty, so we're going to go over the head, neck, and face lecture and just do a quick recap of everything, all the structures, all the muscles, most of the muscles at least, and their movements. And I'll even give you like an actual particular pointer on how to really go about learning muscles and understanding their movements and actions in an easier, better sense. So the way I typically go about teaching the muscles and kinesiology in general is I start with all the bones and the bony landmarks of those bones. Then I move into the joints and then the muscles. The reason for this is that, one, if you understand where all the bones and the bony landmarks are of those bones, then understanding joints becomes a little bit more simple, because joints are, well, as defined, where two or more bones come together and move around each other, also known as articulate with each other. And then muscles themselves will attach from different various landmarks of bones, cross a joint, and attach to another bone in its landmarks. So essentially, the bones are our super foundational piece of information of any kinesiology lecture. And then again, so we'll just learn the movements of the joints as well, muscles themselves. Now, I will have some visual aids, and another way that I say to learn kinesiology very easily is to, well, one, actually do it, because kinesiology is active movement, and believe me, we're going to do some active movement exercises in this video, but also to take a very visual approach with kinesiology. And I know that's not the most easiest way to do so, but if you have a skeleton or a model, a friend, or whatever, or even just the pictures in the book that we'll be taking a look at, just look at that image and ingrain that image into your mind to the point where it's just burned into your mind. It's almost like where you scroll through the social media, Facebook, and you see a picture. It's like, stare at this picture for 30 seconds and then look at the wall, and you stare, and then you look at the wall, and it's like, oh, Jesus. Right? So that's kind of how I want you to be about this material, about kinesiology, right? To be able to see with your mind where this stuff is, and be able to, if on a test question, or if I ask you, where is this muscle or where is this landmark, you should have a visual image pop up in your brain. That's how I find kinesiology is the best learned and the best to implement and put into practice. So without further ado, let's get started on our bones. Now, in regards to the head, neck, and face lecture, well, yes, we also have the neck, which includes lots of vertebrae, specifically the vertebral region known as the cervical region of the spine, which includes 7 vertebrae. And we'll actually do those in another lecture in the spine and thorax. So for now, we're going to focus mostly on the bones of the skull and of the face, and of course the mandible as well. And then for the joint, we're actually just going to focus on the temporomandibular joint, but we will briefly mention and understand the dynamics of how the neck moves, which will actually be more in regards to the vertebral joints, but we'll get to those again at a later time. So first, let's take a look at some of our bones. And if you look at the boards I have here, this is pretty much the whole lecture. So, take a moment to pause this video if you need and write down all this stuff, because this could be your notes and cheat sheet, right? So first off, we have bones of the skull, and well, bones of the skull obviously pertain to the skull, or what we call the cranium, and make the cranial cavity. Boy, this guy needs a little dusting here. So some of our main bones, our simple bones we'll start off with first, is our frontal bone, which is, in layman's terms, our forehead. So right here, little noggin right here, little forehead. Some people got a little bit bigger forehead. They call it a 5 head, but, really, there is a landmark such as the brow ridge, but, no real landmarks that we'll pay super close attention to. Our next landmarks are going to be the parietal bones. So the parietal bones, if you can see in this video, maybe I can dip this guy like we're dancing. The parietal bones are the 2 bones here on the top and sides of the skull. So they make essentially the roof, I guess you could say, of the skull itself. Again, no real notable landmarks to those bones. Then we have the temporal bone, which is right here, which we all know as like the temple, right, where we rub for a headache or something. So the temporal region, or the temporal bone, excuse me, has several landmarks. A couple that we're going to pay more close attention to is, namely, the first one we listed is the styloid process, which the styloid process is this little, if you can see this little sticking out little part right here in the camera. This is actually going to be right below the ear, and it's called the styloid process. And that's why we don't want to press in. One, it's just not comfortable, like ow, like who wants to be poked like in the throat behind, underneath the ear. That just sounds terrible. But there is the possibility of breaking this particular bony attachment and killing your client, because I like to kill them. But anyways, so behind the styloid process is the mastoid process. And this is going to be a very important landmark for us as well, because we're going to see a couple muscles throughout the entire kinesiology course that attach here, such as, well, namely the sternocleidomastoid. I mean, it's part of the name. We also have the longissimus of the erector spinae muscles. We have a bunch of others as well. So mastoid process is definitely a very important one. Another cool one too, you can't actually really see it on here because they didn't really drill the hole in here, but we have what's called the external auditory meatus. External because it's on the outside, auditory, well, because it's for sound, right? It's in a meatus. A meatus is defined as a passageway or a canal. So this is literally the ear canal, right, where sound is going to go through to rattle in little bones inside the skull, and then we're going to hear something. So our next bone that we're going to take a look at is the occipital bone, which is the back, and I guess you could say base, so we can say the ground floor almost in the sense of the skull itself. And several landmarks here. One, we have this little bump here on the back of the skull, which actually, if you feel back there, you might feel like a tiny little pokey part in the back of your head. That's called the external occipital protuberance. This word, I mean, protuberance is just pushing outward, right? It's a bump. Then we have some lines. We call them nuchal lines. We have the superior and inferior nuchal lines, and they're going to be up underneath the occipital bone here. Now, I might have to be able to dip him forward, and since he's actually a whole and complete skeleton, maybe we can see this, but right here, this big hole in the bottom of the occipital bone, where our spinal cord is actually exiting from the cranial cavity here, is called the magnum foramen. So magnum foramen, let's break that down. First off, magnum means big, right? It just means it's, like a magnum, 357 Magnum or something like that. I guess talking about guns, whatever. But it means big, right? Big caliber of stuff. And then foramen is a term to describe a bony landmark that happens to be a hole. And my example to remember that is that think like if you're a mob boss and, you got a guy who wasn't really paying up on his bills, you're going to dig a hole for him. You're going to dig a hole for a man. Right? So magnum foramen literally just means big hole in the bottom of the skull. So everybody's got a hole in their head, right? Get it? A couple of them actually. And that's where the spinal cord descends down. And right alongside the magnum foramen is two bumps called condyles. And we'll actually look at those in another lecture in the spine and thorax, because those landmarks help make the first joint that we see attaching to the spine between C1 and the occipital bone itself. One bone that's really hard to see here also that still makes up part of the cranial cavity is the sphenoid bone. So the sphenoid bone, I often call it the Red Bull bone of the body, because sphenoid gives you wings. Why? Because, well, the sphenoid bone has greater and lesser wings. So if you actually look at it, maybe here, I'll pull up a picture here on the book. It's almost shaped like a bit like a butterfly. So if I can find an actual picture of the sphenoid bone, that would be fantastic. Maybe we'll find it and we'll point it out later. I don't see one particularly right now. So, but anyways, the sphenoid has greater and lesser wings. Like I said, resembles that of a butterfly. And then there is, imagine it is in the sense that it is a butterfly. Imagine if you were going to ride this butterfly, you would have to put in like a car seat or a saddle, right, to ride the butterfly. So on this landmark as well, and hopefully we'll find a picture for it in the book, is called the Sella Turcica, which means the Turkish saddle. I mean, I think Sella is saddle, right, in Spanish? Something like that. How do you say saddle in Spanish? Okay. Gonna montar a caballo. You don't know what you ride on in the caballo? Anyways, I'm gonna have to cut this out because terrible, waste of time. But anyways, so the Turkish saddle, the Sella Turcica, is actually pretty important because we'll learn about a particular gland of the endocrine system called the pituitary gland that sits there and rests, and it's almost like it looks like its throne, its control center of the brain of the body, right? So, last but not, excuse me, we also have those are the bones of the skull. So here are the bones of the face. So these are facial bones that give our face shape and structure, right? We have the maxilla, which is, you know, kind of like the upper bone, kind of part of almost up here on the nose situation as well. We have the zygomatic bones, which are our cheekbones right here. We have inside the nose, we have the vomer, which is this little bottom part of the muscle, or excuse me, muscle of the bone. And then we have the ethmoid up in here. And actually the ethmoid you can see inside the orbital cavity here. So, which makes part of the orbit as well. Inside the mouth, so the maxilla actually even extends into the forefront of the mouth, but behind that is a bone called the palatine, which, you know, think like the palate of the roof of your mouth is the palate, right? There's a bone in there called the palatine. And then we also have the nasal bones, which we can see right here, the two little bones on the bridge of the nose, as we would refer to it as. Inside the eye socket here, we also have the lacrimal, which is, you know, kind of like the tear duct, as we often refer to it as. And then several bones, you know, namely like the sphenoid and the ethmoid and, you know, part of the frontal bone make the actual eye socket or orbit itself. Our last bone that we're going to take a look at is the mandible. And as we can see here, the mandible itself isn't necessarily attached. There's a spring here that's holding it into place. So this jawbone, as we often refer to it, has a few landmarks. One, we have the condyle of the mandible, and we're going to see that as you notice, this condyle is attaching or touching the skull here, and that's going to make our joint, the temporomandibular joint. Right here, we have this little point in front of the condyle called the coronoid process. We have the ramus of the mandible, which ramus just means like projection or offshoot of. So we have this projection here of the mandible called the ramus. We have the angle of the mandible. We have the body of the mandible as well. And so that's all of our landmarks there. So pretty simple, pretty straightforward. So let's take a look at our joints. Again, as we said, joints are where two or more bones come together and move around each other. So, of course, you know, there's lots of joints here in the spine that are going to, you know, we're going to learn those later, but we're going to have to understand the dynamics of the movements of the neck and spine just for the sake of this lecture. But our main joint here is the temporomandibular joint. As we see written out here, temporomandibular joint. If there isn't too much glare on that, we'll just lean that in a little bit. Boom. Acronymed the TMJ, temporomandibular joint. So what exactly are the landmarks and attachment sites for this joint? Well, one, we saw the condyle of the mandible, and then another, I guess I kind of missed that landmark. We have the mandibular fossa of the temporal bone. So the mandible actually touches the temporal bone, temporal bone here. Mandibular for the mandible, right? Fossa. Fossa is a word that means a shallow depression. So you can think like fossas are always sad because they're shallowly depressed. Anyways, so what exactly is the temporal mandibular joint able to do and perform? Well, my jaw so far has been moving quite fast, and right? So this movement that I'm doing here as I'm talking, and can I do my pantomime? What's up, guys? Are you gonna learn something today? So when the jaw moves down like this, we call that depression. So when the mouth opens, we call that depression. When the jaw snaps up and my teeth connect, that's called elevation. To think like if an elevator lifts you up, and then if you're depressed, you're down in the dumps, right? So our jaw can also perform a few movements. So we can jut our jaw forward and create this underbite, very Neanderthal kind of thing. But we call this protraction. I love the head, neck, and face lecture. I got to make all these crazy things. So protraction is where the jaw juts forward and our teeth create an underbite effect. And then if we retract our jaw, we do this. It looked like that dog meme. And so that's where the jaw moves backwards, creating what we call an overbite. Damn, that's a funny looking guy. I could be a puppeteer too, dude. Right? Put my hand up in the cooler. I'm gonna have to edit that one out. And our last movement here is deviation, or what we call lateral deviation, which is to move to the side. So moving to the side, left and right, is called. Whoops. It's called lateral deviation. I can fix it. Don't worry about it. That was without my water. I'm gonna leave that one in there for shiggles. But anyways, so a lot of our muscles in this lecture are going to be involved with, well, either moving the mandible or moving the neck. So with that said, our last little bit, we have lots of joints in our spine and our neck, and collectively they can do this. They can flex the neck, which is to bring the chin down. They can extend the neck, which is to point our head upwards. We can laterally flex the neck, which means to bring the ears to the shoulder or turn to the side. Not turn to the side, but lean to the side. And then we can rotate the neck, left or right. Now, in regards to this rotation, we're going to take a look at some muscles that we have a few specific explanations of how that rotation happens. We have rotation to what we call the opposite side, or rotation towards the same side. Now, when we rotate towards the opposite or same side, what does that mean? It's always in regards to where is the muscle and how is it turning the body. So for instance, if I have a muscle on the right side of my body, such as my sternocleidomastoid, and when this muscle contracts, it turns my head to the left, that means it has rotated me to the opposite side. So get it, opposite side. So if a muscle's on one side of the body, right or left, and it rotates the body to the opposite side. So if the muscle's on the right side, turns you left, it's opposite side. If the muscle's on the right side of the body and turns you to the right, then it's rotation to the same side. So without further ado, let's go ahead and knock out these muscles. Now here we have a brief list of my personal recommendations of muscles that you just have to know. Oh, at least especially the more specific important ones out of this lecture, which include the sternocleidomastoid, acronymed SCM. So our sternocleidomastoid is often referred to as our praying muscle, because they say that this is the muscle that involves the bowing of the head for prayer. So let's go ahead and take a look at the actual page and origins and insertions and actions. Now, when we talk about muscles, let me flip it back here. When we talk about muscles, we talk about origins and insertions and actions. Let me just give a brief explanation of what all that is. So the origin of a muscle is the attachment site that the muscle is attached to, bony-wise, that is going to move the least when the muscle contracts or moves. The insertion is the opposite. It's the part of, or the bone, or the attachment site that is going to theoretically move more. And then the action is, well, when it, for a muscle to be functional, it has to attach to bones and cross a joint. So when a muscle contracts, it's going to perform movements at the joint that it crosses. So the movements that we've seen so far, as we said, was for our temporomandibular joint, right? We had the elevate, depress, protract, retract, lateral deviation. And then for the neck, let me just go ahead and write these in, right? We had flexion, we had extension, I'm going to abbreviate. We had rotation, right, to the opposite side or same side. And then we had lateral flexion as well. So in order to do flexion of my neck, a muscle has to be somewhere around here attached to something that's going to move and then pull me this way. So first up, as we see, is the sternocleidomastoid in this lecture. So again, what I want you guys to do is to just stare at a picture of a muscle until you're blue in the face. Now, it helps more so if you have a 3D model, so you can always download an app to make this a little bit more prevalent, or you can perhaps, use a skeleton or something minus his jaw. He looks crazy like that. Poor guy. I'm gonna fix him later. So in this particular case, our sternocleidomastoid is actually telling us all of its attachment sites. It attaches from the sternum, the clavicle, cleido, and the mastoid process. Now we have one on each side, right? Because there's two sides here of the body, right? I mean, typically all muscles come in pairs, right? I have two biceps, right? I have two pecs, so on and so forth, right? So our SCM is on each side of the neck here, from the mastoid process down to the sternum and the clavicle. Now the SCM does have two bellies to this muscle, which you can see in this picture. So again, we take a look at this particular picture, right? We can see here we have the mastoid process and we have the sternum and clavicle. Now, like I said, this muscle does have two heads or two bellies, and one goes down to the sternum, we call it the sternal head, and then one to the clavicle or clavicular head. So what exactly is this muscle involved in doing? It's involved with, one, like we said, flexing the neck for prayer and rotating the neck. And then since we're actually attached to the clavicle and sternum, we can actually technically and theoretically raise that up a little bit to somewhat assist in breathing. But let's take a look at what we see here in regards to this box of actions, which you'll see unilateral versus bilateral actions. What does that mean? So muscles that attach around the spine are often a little bit more complicated than, say, like a bicep muscle in my arm, because muscles that attach to the spine, well, can, like we said, come in pairs. So I have one SCM on this side and one SCM on this side. Now, I can definitely contract both of them at the same time, but I can independently contract one versus the other. So this is where we get bilateral, bi, two, lateral side, or unilateral, uni, one, lateral side. So either one side of or one part of this muscle or one of the muscles moves and then causes actions, or either both of them work at the same time. And so typically they do have similar actions when they work together, but they'll typically kind of interplay with each other when we see the unilateral action. So for instance, let's take a look at what the actions are listed here. This SCM says that if we contract one side at a time, we're going to laterally flex the head and neck to the same side. And we're going to rotate the head and neck to the opposite side. So let's take a look and see what that actually looks like. So one technique or trick I teach people to do is place your fingers on the attachment sites of a muscle and try to touch your fingers together. So you can see that when I try to touch my fingers together, that means the muscle contracted. Or you can actually see this muscle pop up in the video right here, which is causing my head to turn again to the opposite side because this muscle's on the right side of the body, the right side of my neck. I'm turning to the left. That's rotation to the opposite side. And lateral flexion, as you can see, my head or my ear is coming towards my shoulder and tilting to that side. So now, and I mean, it's the same actions. It's just that the left side is going to turn me to the right. Right side is going to turn me to the left because they're rotating to the opposite sides. Now, if both sides will actually contract, it's going to pull my head forward into flexion. And I know it's slightly complicated because it does slightly extend a small part of the cervical region of the spine. But for the most part, we don't really want to confuse you guys with that. But yes, it will flex the majority of the neck, but the upper like 2 or 3 vertebrae are actually going to be in an extended position in this particular case, but whatever. And then, as I said, if we attach to the rib cage or the clavicles in this case, we can kind of help pull them up to theoretically assist in breathing. So that's our SCM, very important muscle. Really worthwhile to make sure that you get out of this lecture. Our next muscles to look at are the scalenes, which we'll go ahead and pull up a picture of right now. So the scalenes are actually deep in the neck, and you can see that they're attaching to various landmarks of the vertebrae that you can come back to. You should always come back to, SCM and scalenes throughout this course. But when we get to the spine and thorax, we're going to learn about what's called the transverse processes, which are just these little bumps on the side of the vertebrae of the side of the neck. And then we attach to the ribs or the costal bones, namely the first and the second. So we have 3 parts of the scalenes. We have the anterior, which means it's in the front. We have the middle scalene, and then we have the posterior scalene in the back. So an easy way to remember which ones are attaching to which is the first 2 go to the first rib, and then the last one goes to the second rib. So first 2 scalenes, anterior and middle, go to the first rib, and then our last scalene, the third scalene, the odd one out, goes to the second rib. So what exactly are these scalenes doing? Let me go ahead and I'll even show you a little bit more about the landmarks. What exactly are these scalenes doing? So these transverse processes are these little bumps on the side of the vertebrae and neck here. So we're attaching from various transverse processes here and attaching to the ribs. So the scalenes are actually really easy because, and I say to learn the scalenes and the SCM together because they do the same actions essentially, except that theoretically the SCM, the sternocleidomastoid, acts more on the head than obviously the scalenes, because the scalenes can only move so much. But I mean, obviously my head's going to go with my neck, right? So it's just not going to move independently per se. So that means that our actions of the scalenes are exactly the same as the SCM, which means that if both sides of these 2 muscles contract, I'm going to flex my neck forward. If one side contracts, I'm going to laterally rotate, or I'm going to rotate my head to the opposite side, and I'm going to laterally flex my neck, which you can see here in the book as well, right? We have our unilateral actions, right, is to laterally flex and rotate the head to the opposite side. Bilaterally, right, we can elevate the ribs. Oh, didn't forget to mention that. Anytime that a muscle attaches to ribs, it's going to affect breathing in some regards. The general rule is that if a muscle attaches to a rib and sits higher than the rib, which means it's going to pull the rib up, it's going to help with inhalation. And then if a muscle attaches to a rib and then sits below the rib to pull the rib down, it's going to be involved in exhalation. We'll learn about that later on. And then again, bilaterally, we flex the neck as well. So again, SCM and scalenes best learned together, really important. Almost forgot this main muscle right here. I'm going to put that other muscle right up there, is the masseter. And speaking, actually, before I get off the scalenes, one is that the scalenes are probably more involved with impingement of some of the nerves and neurovascular structures in the neck as well. So typically, if someone has like issues with the neck, issues with stuff going into the arm, I would start to work the scalenes, or as we're going to learn later, pec minor, as well as what we call brachial plexus impingement can also occur, because the scalenes, what they can do is they can pull the ribs up, which can create thoracic outlet syndrome. We'll learn about that later, so on and so forth. All right, so our next muscle is called the masseter, often known as the jaw muscle right here, the mighty masseter, as I like to call it, because fun fact, based off of its size, it is the strongest muscle in the human body. Now, granted, the strongest muscle in the human body is arguably the gluteus maximus, but you're comparing a tiny muscle in your cheek versus a giant muscle in the cheek, right? So the size comparison is what really kills us out, but your masseter can put forth a fighting force so powerful that your teeth would break. You have to limit yourself from doing it. So the masseter attaches from the zygomatic bone, and I kind of ripped this guy's head off, or ripped this guy's jaw off, but it attaches from the zygomatic bone and then attaches to the angle here and bit of the body of and ramus of the masseter as well. Now, fun fact also is that the masseter does have two bellies. It has a deeper layer, but not the biggest thing to really confuse yourself about or anything. But let's go ahead and take a look at our actions and all of that good stuff. So our masseter, as we see, can elevate the mandible. Its primary job is to do that, right? It's to close the jaw and clench the jaw together. Now, it can also protract the mandible. As you can see from the picture here, based off of that angle, it could theoretically pull it slightly forward for protraction. But elevation is the main thing we're going to be looking at in this particular case. Another muscle, too, that we're going to take a look at is called the temporalis muscle. Well, as you could probably guess, temporalis muscle comes from the temporal bone. As you can see, it's right here on the temporal fossa, and will reach down, actually coming underneath or in between the cheekbone, the zygomatic arch, and then attaches to the coronoid process of the mandible itself. And so we'll show you guys on that skeleton just exactly what he is in a second. So here we have the actions of temporalis is to elevate the mandible, much similar to the masseter. But in this time, though in this case, we see it's going to retract, because we can see that our angle is to essentially pull it backwards, right? Now, I mean, this is what we call a convergent muscle, because it's broad, and so it has multiple angles of pull. Because I guess fun fact, we should, or for explanation purposes, muscles only pull in the directions that their fibers run. By the way, I should have mentioned that, but we're going to be able to pull this jaw, pull this masseter backwards for retraction. So again, just to recap, for a visual aid, our masseter is attaching to the zygomatic bone, zygomatic arch, and then attaching to the body of the mandible here, and it's just going to elevate the mandible and lock that jaw together, and slight protraction as well. Now, the temporalis muscle is attached right here to the temporal fossa, and actually comes down through, you can see it coming underneath or behind the cheekbone here, the zygomatic arch, and then attaches to the coronoid process. And so again, elevation and retraction of the mandible. However, one key thing to note, especially for assessment purposes about the temporalis muscle, is that if you're working on this muscle for your client, say should they have, like, say, jaw pain or something like that, or headaches, right? Temporalis muscle is definitely a good muscle to work. The most efficient way to be able to work the attachment site at the coronoid process is to have your client to open their mouth or depress their jaw. As you can see, now the coronoid process has moved into a position where I can palpate and work on that bony landmark. So our next muscle will probably be the suprahyoids and infrahyoids and everything here. So one little bone I guess we could have mentioned too in this lecture is this bone right here. If you can see it on camera, it has to be like stapled to the spine, because the hyoid bone kind of looks like that wishbone from a chicken, and it's in the throat, high up in the throat right here, and it's the only bone in the human body that does not touch another bone. But luckily, it has lots of friends to help, keep it company and hang out with it, such as the hyoid muscles. It literally has many groups of friends to hang out with it, and make it feel comfortable and cool. So I can give you a little visual aid on where exactly the hyoid bone is here. So you can see it's right here in the throat, this little bone right here, and as well as another visual aid. So there are groups of muscles, one in which particular we call the suprahyoids, and then another group that we call the infrahyoids. So supra means superior, infra means inferior, supra meaning above, infra meaning below. Needless to say, the suprahyoids attach to the hyoid and then attach above the hyoid to then elevate the hyoid. And then the infrahyoids, well, I guess we'll get a little visual, infrahyoids attach to the hyoid and then below the hyoid and pull the hyoid down. As simple as that. I don't think it's really necessary to learn each and every individual hyoid muscle. There's a lot, and whatever, who cares, right? So our next muscle here is called the platysma, which is actually a very big, broad muscle on the anterior side of the neck, and it attaches to the corners of the mouth and then drapes over, the front of the chest here, essentially. And it's involved with depressing the corners of your mouth and tightening the neck fascia. Matter of fact, if you exaggerate saying platysma, you actually contract that muscle. And you can see here my neck, so you see that tightening of the muscle right here. That is your platysma. And they often call this muscle the creature of the Black Lagoon muscle. Very old movie, if you've ever seen it. Cool. You're probably too old. You should probably, maybe go lay down and take a nap or something. I'm just kidding. It's a great movie. I've seen it 10,000 times. No, I haven't. But anyways, creature from the Black Lagoon. He's like, so if you need a visual aid, you can look up the movie. Maybe take a look at that. Another muscle here, just briefly mention. I'm not going to say that's like super crazy to learn, but we have what's called the occipitofrontalis, which is actually two different muscles. It's called the frontalis muscle and the occipitalis muscle that are connected to, well, frontalis muscle raises the eyebrows and furrows our eyebrow ridge. And then the occipitalis just kind of tightens up behind at the back of the skull. And they're both attaching to the fascia here called the galea aponeurotica, which is also often called the epicranial aponeurosis. Epi meaning on top of, cranial referring to the cranium. Aponeurosis is a thin sheet of connective tissue that connects different muscles together and anchors them to bone. So pretty simple, easy muscle here. Next, we have the pterygoids, medial and lateral pterygoids, pterygoids, right, like pterodactyl. These muscles are actually inside your jaw, and these are the muscles that are involved with the deviation of the jaw itself. So we can say that both medial and lateral pterygoids will deviate the jaw. However, the one restraint is that only the medial pterygoid will elevate the mandible. Ooh, fun fact. So lateral, think out, he's not as cool as the guy in the center. He's in the spotlight, right? The medial guy can do more, right? He can elevate while the lateral guy can't. The longest colli capitis muscles, again, they're really deep muscles in the neck. Cool to learn, but I don't think they're really like important for us to know because we're never going to go in and work those. And if you do, well, be prepared to have your client probably hate you. So then we have muscles of what we call facial expression. And with these muscles, we don't really look at their attachment sites and everything. It's, again, this is a prime example of where just a visual download of this image will help you the most, and just understanding what muscles are going to be doing what. So some of our main ones is orbicularis oculi, which is orbicularis, like orbit, circular, right? Oculi, circular ring of muscle around the orbit or eye socket. What this does is it's going to squinch your eyes shut. Then we have the nasalis muscles, right? Nasalis muscles right here. Again, those kind of like, wrinkle up your nose. And I guess, yeah, maybe I'll just example of them later. Nasalis muscle kind of wrinkles your nose. Then we have the zygomaticus muscles, often referred to zygomaticus major and zygomaticus minor, which are referred to as our smiling muscles because they help to raise the corners of the mouth to help us smile. Then we have orbicularis oris, which is the circular ring of muscle. Again, orbicularis, orbit, circular. Oris, oral cavity or mouth, is the circular ring of muscle around the mouth that will purse the lips and give us the little duck face, pouty face look to ourselves. Some other cool muscles is the buccinator, which tightens up the cheeks. Usually used for like if you're playing a horn or like blowing up a balloon or something. That's going to tighten up the cheeks and everything. Risorius kind of helps along sides of the same thing. Buccinator and risorius do roughly the same ish actions, but and then the book carries on to, see, buccinator. This is a picture of a chick, blowing into a horn. But yeah, the rest of these are just going to give you examples of what your face is going to awkwardly look like when you move these muscles. There you go. Look at that grin right there. And then, oh my God, that is a quite disturbing image of the orbicularis muscle right there. That's a cursed image if I had ever seen one. But anyways, that is the head, neck, and face lecture. So all of our muscles and everything. In a quick recap, it doesn't take too long to really go through this lecture, just because it's not a whole lot of muscles to be involved. So next week we'll do another video on some stuff, and yeah, hopefully we'll see you there. Take it easy. Yeah, I was like, should I really recap something or something or anything? But it was